Welcome back to Still Here. In the last episode, we talked about the experience of caregiving, what it can feel like to carry the responsibility over time, and how much of that experience often goes unseen. Today, I want to turn to a question that many caregivers and many clinicians find themselves asking. What does good care actually look like in dementia? It is a simple question, but not an easy one. Because the kind of care that works in dementia is often different from what we are used to. In many areas of medicine, we focus on fixing problems. We correct the wrong. We try to bring things back to how they were. But dementia doesn't work that way. And when we approach it with that mindset, it can often lead to frustration for the person living with dementia and for the people caring for them. What often helps is a shift, not in how much care, but in how we understand what the person is experiencing and how to respond to it. Let us first talk about the correction reflex. This does not need to be complicated. I should know better than to correct my mom, but I do it anyway because I guess it's reflex. In the beginning, when my mom would say something that was inaccurate, my sisters and I did not let it go. We would correct. When we realized she had dementia, we still corrected. Not deliberately. It was a difficult habit to break, but like anything, it got better. Now, we all just look at each other, but we don't correct. Correction is human. However, adjusting to the situation is also human. Because correction often increases distress. We let adjustment and accommodation set in. Next, I want to talk about emotional reality over factual accuracy. What do I mean by this? How important is it to let the affected person know the truth that will be forgotten, but the emotions, usually negative and heavy, that could linger? My mom's younger brother passed away as her memory was shifting. It was a crucial time. As a matter of fact, in retrospect, my sisters and I believe that she had a significant decline when that happened. They were close. As months and even years went on, my mom had forgotten that he had passed away. She would usually ask if he was coming over or if he was invited to a certain family event. I know it is truthful to say he passed, but how many times will I say that? The same number of times that she will feel sad all over again. So I stay quiet. Sometimes it stops. And if she asks again, I alternate between he is coming, or I think he could be busy today. The actuality of where my uncle was will be forgotten, but the emotional experience stays a little longer. Another is in dementia, when language and memory become less reliable. Behavior often becomes the primary way a person communicates what they are experiencing. As I had discussed in episode 4, behavior is not random. And it is not simply loss of control. It is often an attempt to express a need, respond to discomfort, or make sense of a confusing environment. As conditions like Alzheimer's disease progress, several things change. Language becomes harder. So does finding words and organizing thoughts. Memory gaps increase, so the world feels less predictable. Processing slows, so situations feel more overwhelming. Emotional regulation shifts, so responses may be stronger or quicker. A few common examples of these behaviors can be pacing or restlessness, which could be the person saying they're overwhelmed. Someone who is agitated may be confused, overstimulated, or uncomfortable. A person with dementia may repeat themselves over and over, possibly because there is no retention, or they may be looking for reassurance. Suspicion or paranoia may be secondary to increasing memory gaps and trying to make sense of missing information. Resistance to care is not necessarily about being difficult, but this may reflect fear, loss of control, and confusion as to what is going on, and more importantly, being assisted can feel unfamiliar, sometimes even threatening. Behaviors most of the time happen for a reason. Usually, there is discomfort. It is less about the behavior and more about needing a sense of stability. When we see behavior as communication, our role shifts from correcting it to understanding it. Behavior in dementia is often not the problem. It's a signal. When memory and language begin to change, behavior often becomes one of the clearest ways a person can express what they're experiencing. And when we begin to listen to behavior in that way, it can change not only how we respond, but how connected we feel in those moments. So, what actually helps? What can help could be some guidance and insight without turning them into rules. It is how we approach and how we respond. It is meeting them where they are. Let us try to respond to their emotion and not their thought content. It is about making them feel better and not about correcting. My mom was very upset this one time because she thought she missed an appointment. I don't think I could have made her felt better if I insisted that she actually did not miss an appointment. It was not easy. But I just had to acknowledge the frustration that she was feeling and give reassurance that the appointment will be rescheduled. Also, let us try to simplify and structure their environment. Less choices means less decisions, means less frustration. Let us be more flexible. I agree. In many areas of life, consistency is key. But in dementia, flexibility is often more helpful. Remember, what worked yesterday may not work today. What often helps is not trying to bring the person back to our reality, but meeting them in theirs and responding to what they are feeling in that moment. Lastly is dignity. Dignity is not something a person loses, but can be diminished by the way others respond. Most of the time, dignity is diminished unintentionally. Dignity in dementia isn't something that depends on memory or independence. It is shaped by how a person is treated in each interaction, whether they are included, respected, and seen as a person. Even if their abilities change. As we think about what good care looks like in dementia, it becomes clear that it isn't defined by perfection. It's not about always knowing the right thing to say or always responding in exactly the right way. Much of the time, it's about something quieter. It's about paying attention, adjusting, responding to the person in front of you as they are in that moment. When we begin to shift from correcting to understanding, from focusing on facts to responding to feelings, from managing tasks to preserving dignity, care can begin to feel different. Not necessarily easier, but often more connected. And in many cases, more sustainable over time. Because what supports the person living with dementia often also supports the person providing care. In the next episode, we'll turn to something that families discover along the way. What remains, even as so much begins to change. Thank you for listening to Still Here. Wherever you are in this experience, I hope these conversations bring a little more understanding and remind you that you're not alone in it.